Okay, if you could introduce yourself and the name of the practice.
I'm Dr. Corey Russell, and our practice name is Foot and Ankle Physicians and Surgeons.
You have a lot of patients that come in with hammer toes and bunions. What are the treatment options?
Typically, people that come in with those kinds of problems, they've had it for some years. It's become progressively more painful. The deformity's gotten progressively worse. They try, typically before we see them, different shoes, wider shoes, deeper shoes, to accommodate either the bunion deformity on the side of the big toe or their hammer toes. Obviously, it's a contracture of those toes, which the shoes will then rub typically on the top or the tips of the toes. Typical conservative treatments, padding of those bumps to keep it from rubbing. Like I said, modify the shoe wear to see if that alleviates some of the rubbing and discomfort. If that doesn't work, then they're more of a surgical problem. So typically they're outpatient surgical procedures we perform to straighten out the big toe, reduce the bump. In the case of a bunion deformity or in the hammer toes, typically we straighten out the toes so they're not crooked, and that alleviates the deformity once they are recovered from their surgery.
And if someone has more questions on this, what's the best way to reach you?
Well, we have 5 locations in the Toledo area. The best way is probably just to call the main number. It's 419-473-0125.